Therapist with Spaniels with Dr. Judy Morgan.
Folks from all over the place. Beautiful sunny day here. Too cold for me. Still a nice day. I'll take it. It's not raining.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
So I'm not sure that today is really oh, hey Joey, my coffee cup is sitting on that coffee pot right there. I forgot about it. You just reminded me. Man, oh man. I haven't had enough coffee. I can't even remember where I left it. Thank you very much. So, I don't think this is a rant, but it's sort of a what the. So my sister texted me over the weekend, or maybe it was Friday, but she had a client whose dog had either Struvite crystals or Struvite stones in the bladder on urinalysis. And so her veterinarian was nice enough to give her advice on how she needed to feed her dog. And so my sister sent me this text and said, "This doesn't sound right to me." My sister's not a veterinarian. She's a physical therapist for humans and their animals. Does craniosacral and T-touch and all kinds of fun stuff. So, she said, "I'm pretty sure this is bad advice that she got. I just want to check in with you before I give her advice." So let's talk about, and I have talked about bladder stones and crystals till I'm blue in the face over the past few years, but we're going to talk about it again because apparently the veterinarians need to be educated as much as the pet owners do. So we've got lots of different, and if you decide to take my lab course, you'll see lots of information about crystals and urinalysis and how the different crystals and stones are formed and in what pH and that sort of thing. But we're just going to do a really quick down and dirty here. So there are stones that animals form, both cats and dogs and people, based on the pH of the urine, and some are diet related and some have a lot to do with genetics. However, Struvite stones or triple-phosphate stones, ammonium magnesium phosphate stones, they have a lot of different names, or crystals, because crystals are the beginnings of the stones. Enough crystals get together and form a lump and you got a stone. And Struvites are formed in a high pH, which occurs when we have bacteria in the urine and we get enough crystals and enough stuff to form if we have a high pH, presence of bacteria, so infection in the bladder or in the urine, and red blood cells, white blood cells, a very concentrated urine that's not being flushed out of the bladder. That's how you get Struvite crystals and stones. The miracle cure for Struvites? Well, first you get rid of the stones if they're there. They can be dissolved with diet, although it's pretty tough on the animal to do that. Me personally, I always recommended surgery because in an hour we can be done. Stones gone. Bye-bye. Now we just keep them from coming back. So how do we keep these stones from coming back once we get, if we take them out, whatever, or if we just have the presence of crystals and we don't want more crystals to form, we don't want stones to form? Well, what do we have to do? we have to lower the pH. How do we lower the pH? Get rid of the infection. Get rid of the bacteria. So how do you know which antibiotic to use if that's how you're going to treat your bacterial infection? You do a culture. You do a urine culture, and then you treat the infection. After you finish the antibiotics, you do another culture, and you make sure that the infection is completely gone. Then you get your little urine dipsticks and you monitor urine and make sure that the pH is staying low, that the bacteria are not present, that you don't have red blood cells, that you don't have white blood cells, and that then you take a sample in at least once a month and have a complete urinalysis done so they can look under the microscope and say, hey, look at that, we don't have crystals anymore, we don't have bacteria, we don't have red cells, we don't have white cells, yay, problem solved. And then you be very diligent about not letting your dog or cat develop, and this is much more common in dogs, by the way, not letting them develop another urinary tract infection, because that's going to bring the pH and make them up higher, and it's going to make them make crystals and stones. So this is such a simple, like, I love when I get struvite stones. Now, where the problem comes in is if we have an animal like a dog with a recessed vulva who is constantly getting reinfected, well then okay, now we have to go fix that problem. If we fix the cause of the infections, so this one, by the way, folks, has nothing to do with diet. Nothing. It has to do with infections, bacteria, red cells, white cells, high pH, not diet. So the advice, this brings us back to our original story. Sorry, I had to give you the little education behind that. Brings us back to our original story. So the veterinarian says to this owner of this dog, oh, your dog has urinary crystals that are struvites. Your dog has to have a vegetarian diet for the rest of its life. Wait, what? What? Why? What? Where did that come from? And what veterinary school did this doctor go to? No. A vegetarian diet has nothing to do with this. And by the way, not species appropriate, not something that we should feed our dogs. And if that's the advice we're giving to cat owners, we got a much bigger problem. Luckily, this happens to be a dog. So the owner had been feeding Honest Kitchen. So it's, as a complete meal, just rehydrate, feed, done. Great. High moisture diet. Exactly what the dog needs. Oh yes, it has meat in it. Exactly what the dog needs for good health. Then the other thing she said to her is, oh, and your dog can't have spinach anymore. And there happened to be spinach in her Honest Kitchen mix, along with the meat. What does spinach have to do with struvites? Nothing. What's the problem with spinach? If you have oxalate stones, spinach is high in oxalate. Remember, this dog has struvites. Totally different. Struvites, high pH. Oxalates, low pH. Totally different disease. Honest to God, I can't make this stuff up. So, furiously, a lot of times I don't answer my sister because I got too much to do. I'm furiously texting her saying, please tell this owner that this is the worst advice in the world. She absolutely does not have to put her dog on a vegetarian diet. She does not have to avoid foods with oxalates in them. That is not her dog's problem. And what she needs to do is get the infection cleared up, monitor the urine for infection ongoing, get that urine pH down to where it needs to be. We want our urine pH to be 6.5 to 7, maybe even 7.5 on a good day. That's where we need to be. So this is where you guys need to educate yourselves, arm yourselves with information. Because when your veterinarian gives you absolutely contradictory, irrefutably wrong information, you need to be able to say, I don't think I'm going to change my dog to a vegetarian diet. I think I'm going to get the infection cleared up. And here's how we're going to do that. We're going to get a urine culture. We're going to use the right antibiotic. And then we're going to monitor to make sure that the infection doesn't come back. Sound good, Doc? Sounds good. So, Tomorrow I'm going to talk about the lab course that is now available. We have a simple form and a more advanced form. The more advanced form talks about this kind of stuff, a lot more in depth, as well as liver enzymes, kidney enzymes, all that kind of stuff. So we're going to talk about that tomorrow. But this is why we make these courses. This is why we provide this information, because you guys need to be armed with information. So, yeah. Let's help keep our veterinarians towing the line. I love my profession, but I really don't like when my profession provides absolutely wrong information. So we're going to educate people. Thanks, whoever is, that's probably Gwen, posting articles about my crystals and great rant. Basically educate ourselves, yes. Just crazy. So, jumped on late sounds like Soapbox Tuesday. It wasn't. It was just education. Maybe it comes across as a rant or a soapbox. I don't know. It's education. Need more coffee. Today we're working on our hospice course. So much to do. So much. All right, bye everybody.
Remember, you can purchase all of Dr. Morgan's products
I'm trying to
at
do
her
this with my
website
mouse.
at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.